Imagine it's 2 a.m. You're responding to your third overdose call of the night. Same apartment complex, same young man. You revive him again, and you wonder, how many more chances does he get? Welcome, and thank you for joining us today with the Center for Behavioral Emergency and Addiction Research at UT Health Houston. Today, we're not just talking about protocols, we're talking about people, about survival, and about hope. This session was designed with first responders and healthcare professionals in mind: EMS, law enforcement, fire, corrections, nursing, and mental health, because you are often on the very front lines of the opioid crisis. You see the repeat calls, the overdoses, the same names and faces coming across your radios. You also see the toll it takes on families, on communities, and on your own mental health. At the same time, the principles we're going to talk about today apply far beyond first response or healthcare. Anyone in a community, teachers, faith leaders, parents, neighbors, can benefit from understanding harm reduction. Today, we're not going to talk about harm reduction as a political term, not as a controversial idea, but as a set of practical, evidence-based tools that keep people alive, keep you safer in the field, and help communities move forward toward healing and recovery. Here's the foundation. Harm reduction starts from the reality that people will always engage in risky behaviors: drinking, smoking, driving too fast, spending too much time in the sun. These behaviors don't disappear because we tell people to stop. The truth is, no human behavior can ever be fully eradicated, but what we can do is reduce the harm these behaviors cause. Harm reduction doesn't mean approval of risky behavior. It means asking, how do we keep people safe today, even if they're not ready for change tomorrow? It's about survival first, because without survival, there is no chance of recovery. Let me ask you, have you ever buckled a seatbelt, worn a helmet, used sunscreen? Then you've practiced harm reduction. It's not radical, it's common sense, it's safety. You're already practicing harm reduction every day. When you buckle your seatbelt, it doesn't stop accidents, but it does lower the risk of dying in a car accident, and it greatly reduces the risk of serious injury. When you wear a helmet, whether on a bike, motorcycle, or on the job, you are reducing the risk of a head injury. Sunscreen significantly lowers the risk of skin cancer. It doesn't mean you'll never get sun exposure, it just makes being outside safer. And as for speed limits, we know crashes still happen, but lower speeds save lives and reduce the severity of injuries when they do occur. These are all harm reduction strategies. They're not controversial, they're just common sense safety measures. Harm reduction isn't new. Public health has been using it for decades. Let's look at some examples outside of substance use. Masks and respirators. During COVID-19, mask use reduced risk of infection significantly. Masks did not guarantee safety, but they reduced the risk for healthcare workers, first responders, and the community. Contraception. Access to affordable birth control reduces unintended pregnancies and has been linked to higher educational and workforce participation for women. Again, it doesn't demand abstinence, but it reduces harm and it opens up life opportunities. Designated drivers. We all know this one. We won't stop people from drinking. We encourage them to make a safer plan. That one small decision can prevent a fatal crash, and it reduces the number of traumatic accidents that first responders have to respond to. PrEP. Pre-exposure prophylaxis is a daily pill that reduces the risk of acquiring HIV from sex by about 99% when taken consistently. It doesn't ask people to stop having sex. It gives them a tool to stay safe while living their lives. The message here is clear. Harm reduction isn't radical. It's the way we've always done public health. Seatbelts, condoms, masks. These are standard safety measures we've already embraced. Now let's take the same principle and apply it to substance use and opioids. These behaviors may be different, but the logic is the same. People will use, and our job is to reduce the harm and keep them alive long enough for recovery to be possible. Prevention and harm reduction aren't opposites. They're on the same continuum. Primary prevention is stopping or delaying use before it begins. Education, community programs, and youth engagement. Secondary prevention is catching problems early through screenings, early intervention, such as fentanyl test strips. Tertiary prevention, or harm reduction, is minimizing harm when use is already present, such as syringe services, naloxone, peer support, and treatment connections. Notice the arrow goes both ways. Prevention efforts can lead someone to seek help, and harm reduction keeps people alive long enough to benefit from prevention or treatment later on. For you, that means you're not just showing up in a crisis. You're part of a continuum of care that begins long before and continues long after a 911 call. Harm reduction is grounded in the principles that line up with your work as first responders and healthcare professionals. We meet people where they are. If someone is using, our first responsibility is to keep them alive, not to demand they change overnight. We treat people with dignity and respect. People with substance use disorder are not criminals. They're not junkies. They're patients. They're community members. Their parents, siblings, and their colleagues. We believe in evidence over ideology. The data is overwhelming. Harm reduction saves lives and it reduces costs. We believe that incremental change counts. One safe call, one less use, one more connection to care. That is progress. And for you, this approach reduces combative encounters, it builds cooperation, and it makes your job safer and more effective. Harm wears many faces. It's not just the tragedy of overdose, it's the quiet suffering of untreated disease, the trauma of repeated hospitalizations, and the fear of stigma. When someone feels trapped by addiction, by judgment, by despair, that's harm too. Death is not the only harm we're trying to prevent. Yes, overdose is urgent, but harm shows up in many forms. Living with untreated HIV or hepatitis C is harm. Preventing those infections means fewer years of suffering for the patient and less risk of exposure for you. Repeated hospitalizations are harm. They drain families, communities, and healthcare systems. Trauma is harm. When people hide their use and you're called into the worst case scenario, it leaves lasting marks on you too. And perhaps most importantly, loss of choice is harm. People need the freedom and support to make changes at their own pace. Harm reduction gives them time and space for recovery to even be possible. So remember, it's not only about preventing death, it's about reducing all forms of harm. These are some of the best known harm reduction tools in substance use. Syringe service programs offer clean needles and safe disposal. They've been shown to reduce infections and the incidence of accidental needle sticks for you. Overdose prevention sites offer supervised spaces where overdoses are reversed on the spot. In hundreds of thousands of visits, research has shown no fatal overdoses have occurred at these sites. Fentanyl test strips are low cost, quick, and effective at preventing accidental overdoses. Naloxone kits and training. Naloxone is life-saving and has no abuse potential. Everyone here should have it, and everyone in our communities should have access to it. Safer smoking and injection supplies have been shown to reduce infection and injuries, and they create an opening for trust and care. Never use alone hotlines. Someone stays on the line while a person uses, calling EMS if that person becomes unresponsive, turning a likely fatal overdose into a survivable event. These are not abstract ideas. They are real tools you may already be seeing on the ground. One of the most powerful harm reduction tools is medication for opioid use disorder, or MOUD. Buprenorphine reduces cravings and withdrawal symptoms so people can stabilize and function. Many of you see patients on Suboxone in the field. Methadone is a long-acting opioid agonist given daily under supervision. It has been shown to reduce illicit opioid use and improve health outcomes. Naltrexone blocks the euphoric effect of opioids, helping to prevent relapse. The evidence is clear. People on MOUD are about 50% less likely to die from overdose. These medications are safe, effective, and endorsed by every major medical body. For first responders and healthcare providers, this means fewer repeat overdoses, fewer acute crises, and more opportunities to connect people with ongoing care. Harm reduction isn't just about the immediate moment. It's about building stability for the long haul. Harm reduction goes beyond equipment. It includes wound care, vaccinations, STI testing, all of which prevent long-term health consequences. It also includes peer support programs. For first responders, this is especially important. Colleagues helping colleagues process trauma, share resources, and break stigma. Harm reduction is about building multiple doors into care so that whether someone enters through a clean needle program, a peer supporter, or a clinic visit, they're not shut out. These tools only work if people can actually get them. Think about where you see people in crisis: shelters, food banks, jails, bus stations, emergency department waiting rooms. Those are the places where naloxone, clean supplies, and information need to be available. If access is easy, people can make safer choices, and they don't have to go underground to survive. They're more likely to connect with you and other professionals when they need real treatment. Harm reduction works, and the numbers prove it. It saves money. Every dollar spent saves multiple dollars in medical and legal costs. It reduces disease. Syringe programs significantly reduce HIV and hepatitis C infections. It prevents overdose deaths. Naloxone is the best example. It improves safety for you, fewer discarded needles, fewer high-risk calls, and it helps people into treatment by building trust and keeping them alive long enough to choose recovery. This isn't about theory, it's about real results. Let's pause for a moment. Have you ever heard someone say they have to hit rock bottom first, or naloxone just encourages more use? These myths persist, but the data tell a different story. Now that we've looked at the evidence, the outcomes, and the tools, let's take a moment to address some of the misconceptions that often give harm reduction a bad name. One myth is that harm reduction encourages drug use. The evidence shows the opposite. People who access these services are more likely to survive and eventually seek treatment. Another myth is that people have to hit rock bottom before we can help. In reality, waiting often costs lives. Harm reduction allows us to support people at any point on their journey. Some believe naloxone makes people use more opioids, but studies consistently show that it doesn't increase use, it just saves lives. There's also the belief that harm reduction undermines law enforcement. In fact, it often makes your job safer. Fewer needle sticks, fewer chaotic overdose scenes, more cooperation from the community. And finally, harm reduction is not just about drugs, and it's definitely not about giving up on recovery. It's about creating safety and trust so that recovery becomes possible. By now, you've seen that harm reduction is simply an extension of the safety practices you already believe in. It's not about enabling, it's about preserving life and dignity. Many of you are already familiar with naloxone. You carry it, you use it, you've seen it save lives. Now, what I want to do here is share some key reminders and common questions that come up around Narcan in the field. First, it works quickly, usually within 2 to 3 minutes, but it only lasts 30 to 90 minutes. That's why we encourage community members to call EMS and stay with the person. The opioids can outlast the Narcan. With fentanyl and other highly potent opioids, you may need multiple doses. That doesn't mean you did something wrong. It's the drug's potency. Naloxone is extremely safe. You cannot abuse it. You cannot overdose someone with it. You can give multiple sprays if you need to. And a really important point, if the person is overdosing on something other than opioids, naloxone will not do a thing, but it also will not cause harm. So if you're unsure, it's better to give it. And here's something that many people don't know. Studies have shown that naloxone can remain effective years past its printed expiration date, even when it's been stored at high temperatures like a glove box in a car in Texas. It may be slightly less potent, but it's still far better than not giving it at all. So the bottom line is this: when in doubt, spray the Narcan. It's one of the safest, most effective tools you carry. Access matters just as much as knowing how to use naloxone. In Texas, there are several ways you and your communities can get it. Many pharmacies provide naloxone without a prescription. You can simply walk in and ask. Local health departments often have free distribution programs. Harm reduction organizations across the state also provide Narcan and free training. South Texas Overdose Prevention has a simple online request form. They'll ship out the generic version of naloxone nasal spray, which is the same medication as the brand name Narcan, directly to you, usually very quickly. Naloxone Texas also offers an easy online request form, and it maintains a map of distribution sites across the state. They'll also ship kits to you. And finally, there are national resources like Narcan.com and Next Distro. They can mail kits directly to your home. The message is clear. Naloxone is no longer hard to get. The challenge is making sure everyone knows where and how to access it. Encourage families, community partners, and your own agencies to carry it. It's like a fire extinguisher. You hope you never need it, but when you do, it saves lives. Let's look at a few more real-world harm reduction tools that are already in practice. Bad batch alerts. When a contaminated or unusually potent drug supply is circulating, public health departments and harm reduction groups issue real-time alerts. These can be text blasts, social media posts, or flyers at bus stops. For you, this means people in the community are more aware of the risks before using, which can reduce the number of severe overdoses you are called to respond to. Dance Safe. At music festivals and nightlife events, Dance Safe provides on-site drug testing, education, and harm reduction supplies. They don't encourage use, they just meet people where they are, often preventing overdoses by helping someone test their pills or stay hydrated. Think of it like offering water and med checks at a marathon. It's just safety applied in a different setting. Know your source. This slogan is part of multiple campaigns reminding people that the drug supply is unpredictable, especially with fentanyl contamination. It promotes testing and careful use practices. For first responders, the benefit is clear. fewer emergency calls from accidental overdoses when people test their substances ahead of time, and the Never Use Alone hotline. This is a US-based phone line where someone can call before they use. A trained volunteer stays on the phone, and if the caller stops responding, the volunteer immediately dispatches EMS to the location. For first responders, that often means the difference between arriving to a survivable event versus a fatal one. So here's where we land. Harm reduction recognizes that people will take risks and that our job is to reduce the harm those risks cause. For you, that means fewer overdose deaths, fewer dangerous calls, fewer needle stick injuries, and more people eventually reaching treatment. For the community, it means lives saved, families kept whole, and trust is built between responders and the people they serve. A closing thought. Dead people don't recover. Every time you keep someone alive, you give them another chance at recovery. Compassion isn't weakness. It's a powerful tool that works. So before you leave today, do one thing. Make sure you know where to get naloxone for yourself, for your team, for your community. Because the next life saved could be someone you know.